Hello there, and welcome to Dr. Greg and Monica's Lifestyle Solutions on Health and Conditions.
What are we going to talk about today?
How about talking about the importance of prehab? What is prehab?
That's prehab?
Pre-rehabilitating as opposed to actual rehab after a certain injury. Tell us a little bit about why it's so important to prehab.
A lot of it when a person has surgery, the surgeon can do a perfect job. But what will make or break that surgery, pretty much three factors. One, nutritional status of the patient. Do they have enough things to recover? A lot of people have heard about the rehab part, which is get a joint moving, turn on some nerves, eventually strengthen it, loosen it up, those things after that kind of a surgery. And different kinds of rehab for different things, so I'm thinking more in terms of joints today. Prehab is how to condition the area right around, in this case I'm thinking of joints, but also your overall body health to reduce inflammation, support repair, turn on the nerves, and do some specific, in my belief too, make a stronger, extra mind-body connection with the part that's preparing to have surgery.
So what would some of those supplements and exercises be that would help to get ready for an upcoming, let's say, a surgery or a procedure?
To some degree, it'll depend on the joint, but let's talk about knees. I've had several. I've guided other people in my clinic, which is chiropractic acupuncture. It's mostly knees, shoulders, and backs. Well, back or neck, spinal surgeries primarily, though there have been some other people with other things. But for example, knee surgeries, you've got to deal with what does the knee do? It supports body weight, it balances you, and it bends. First thing, a good thing is to have extra turmeric, which is an anti-inflammatory. That's the very first thing. Several weeks long ahead if you want. I had a chance to test that, which is a time, two different surgeries. The one when I had turmeric, the first recovery was good. The second one, the surgeon barely believed how quick I was getting better.
Now when you're talking about it can be long, a long time from when you're having
Correct.
surgery. How long? 1 month, 2 months,
For
6 months?
surgery, probably a month, though I had actually started for general health reasons an entire year before.
Okay.
Because turmeric is just good stuff. It just is for all kinds of things. Another one, they're called proteolytic enzymes, which is really a fancy name. It's a set of enzymes that actually help the body reduce inflammation at double speed. It's really that. Not drugs. They just help your body do its thing, except a whole lot quicker. As a professional of a product, we have protease inflammation control that manufacturer will work with. We've had tremendous success with that. Those two things, and then cut your sugar out so you're not as inflamed. And for several months ahead, boost your omega oils. Then that also deals with pain reduction and also correction of some hormonal issues. You're now set. Second thing is to strengthen, not even so much strengthen, but to activate that joint from every possible angle. Part of it goes towards turning nerves on, literally. And some of those go into simple exercises, but some of them very slow. Some of them on one leg, so you have to deal with the balance and wobble effect. Some of them very quick to kind of activate nerves, activate nerves, activate nerves. So you're really trying to turn on a lot of nerves, a lot of patterns in balance, and then get the better mind-body connection. This you do, some people only a couple of weeks. Seriously, it takes a couple of months if you're not really familiar with that. That's a good portion of the prehab for a joint.
You're talking about, with the lower body, but you can do that as well.
Any
would it
joint,
be shoulders?
all
Would
of
it be
them.
elbows? Would it be
Anything.
wrists?
Anything. You would just need, ideally, if you know your way around the gym, the thing is the variation. Do an exercise, let's say we're talking about shoulders. Do two sides, do one side. The shoulder's got a bunch of angles to it, so much variety, then changing the cadence. Fairly slow, then very quick. Not super heavy, that's unnecessary. It's more towards variation, activation. It's more that, not so much trying to gain a whole lot of strength. It's a different process here.
You know, that's interesting because on another note, that's the kind of thing, let's say for those ladies who might be pregnant, slightly same kind of thing where you're talking, you don't have an injury here at all, but I think if you do certain exercise, now you don't want to start something new that you've never done before you were pregnant. But so many times when we get pregnant, we just stop everything and say, okay, I can't do this anymore because I'm pregnant. That's not the case.
Correct.
You might not be able to jump up and down. You might not be able to lift things that are very heavy, but there's a way almost you're rehabbing your body beforehand so that it is so much readier to
Absolutely
get back
so.
to what it needs to be after you've had your baby.
We've watched with Monica and a number of fitness-minded patients. It's incredible because pregnancy is a really big deal. It just is. Delivering a baby is really big stuff. But what I noted is that if women, well, Monica, for example,
4 children.
Yeah,
So went through it 4 times.
The day before our number 1 daughter was born, we were hiking up a small mountain in Northern Ireland. And it took a little extra time, and it was even kind of slippery, but we got there. 1 week later, we were up that same mountain. 6 days after our oldest daughter was born, I was carrying, Monica was walking up that very same thing. She had kept a good regimen, not a lot of weights, but a lot of walking, hill walking, up and down that hill or small mountain periodically, and that was true for all 4. So, and then I've seen this with a lot of fitness-minded women. They're also usually pretty good at their diet at that stage too. But that makes the pregnancy, of course it's a big deal, but if a woman's body is designed for this, so if it's a healthy body, a fit body, a ready body, it's the big deal. But it's not trauma, not like that. You know, it's a big week out, but then the fitness kind of takes a dip for a little while. And then you kind of gradually build up, then ready to go again. It's remarkable, absolutely remarkable.
So whether it's prehabbing for a surgery, for an injury that you've had, it could even be like we sort of changed it into a different topic when talking about pregnancy and women. All of these things, you're preparing your body to do some things, to even go through a very stressful incident and then get right back to where it was before.
Nerves, muscles, and don't discount the mind-body connection, because that, in a way, is how you activate the nerves, increase and improve the hormonal profile, and that's how you get these things done ever so much better.
Keep those questions coming. Invite your friends to subscribe to our Dr. Greg and Monica Lifestyle Solutions YouTube channel, and we will keep on answering. See you next time.
See you next time.